Alyssa Dweck, welcome back to the Valder Beebe Show. How are you?
I'm very well. Thanks for having me.
I'm excited to talk with you, and I want my audience to know Dr. Alyssa Dweck. She's a board-certified OBGYN and a medical advisor at UCORA.
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 UCORA. Okay, got it.
Yeah.
UCORA. Tell me, let's talk about something I can pronounce, UTIs. Tell me, why is it more common in women than men?
Oh, my goodness. UTIs are so common. We note 11 million cases of urinary tract infection every year in the U.S., which is unbelievable. And it is more common in women for a couple of reasons. Mostly, women have a short urethra. So this unique anatomy makes women more prone to infection because bacteria can more easily get into the bladder. Also, the hormone changes that occur during the entire reproductive lifespan can increase risk of infection in the urine for women.
I have two questions. The first one is, you said a short urethra. Is that short compared to what?
Compared to men. So we don't see, especially young men below the age of 50, getting UTIs as frequently as women. Approximately 60% of women will experience at least one UTI in their lifetime, and many will have recurrent infection. The urethra in women is about 3 to 4 centimeters, whereas in men it's 20 centimeters approximately. So you can see there's a big difference and a much longer transit time for bacteria to get into a man's bladder than a woman.
When I have heard of women having UTI, it seems from the more advanced population. Is that true, or it's just across the board?
Women certainly can have a simple UTI, which is just bacteria in the bladder with very uncomfortable symptoms, and treatment is normally afforded with an antibiotic if needed. But the more complex infections can occur at the extremes of age for sure, and also with certain states like pregnancy or menopause and that type of thing.
Tell me some of the symptoms of when you get a UTI. Since it's not so common, you may not recognize the symptoms.
Yes, well, if anybody's ever had a urinary tract infection, the symptoms are all too familiar and they can be miserable. Urinary frequency, so running back and forth to the bathroom. Urinary urgency, so that intense urge to go. And of course, discomfort with urination. These are common symptoms of an acute urinary tract infection.
What happens if you continually get these? What is it saying, and what do you do?
Sure. Recurrent urinary tract infection typically indicates more than 2 documented infections in 6 months' time. And yes, plenty of women do experience recurrent infections. So the preventative tips I mentioned can be super helpful. Women can also take cranberry-containing supplements, including UCORA Flush Advance Plus, for prevention of recurrent urinary tract infection.
What about what you're talking about? Is it sold over the counter? And what does cranberry juice really do?
Yeah, well, cranberry juice is super helpful, but it may not be concentrated enough. The supplement I'm speaking about does have a clinical strength of cranberry, so it's a dose that's been studied well. And what it actually does is it contains something called PACs, which makes the bladder super slippery to the bacteria called E. coli, which can cause urinary tract infection. So the bacteria can't stick as well to the bladder, less chance of recurrent infection. And in fact, this is a recommendation from the AUA, the American Urological Association.
If you feel you have a urinary tract infection, is it your doctor who deals with this, or a urologist? Where do you go?
Well, many women will turn to over-the-counter remedies and tips that I've mentioned, but certainly if you have fever, blood in the urine, back pain, or things just don't seem to be getting better, absolutely visit either your primary care physician. Many women go to their gynecologist, and oftentimes will send to a urologist if things are more complex.
Very complex interaction, very simple. I really appreciate it. Where does my audience go online and get more information?
Yes, thank you for bringing this to light. Please visit ucora.com for information not only on product offerings, but for educational material on urinary health care in general and community.
Dr. Dweck, I really appreciate you. They told me you were one of the smartest women in the field, and you have proved that. Thank you so much.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.